Hi, I'm Dino Tripodis. This is the first Whiskey Business podcast of 2022. And on tonight's installment, Oma, come on, enough already. Can we live to be 100? And a whole lot more as our guest, Dan Skinner from the podcast Prognosis Ohio, a health podcast to our health on Whiskey Business. Dino Tripodis, and welcome to Whiskey Business, the podcast not so much about whiskey as it is one with whiskey. This is our first podcast of 2022, gentlemen. Welcome back, everybody. Hooray. May old podcast be forgot. And as we move on forward to our new year.
What the hell is Auld Lang Syne anyway?
Yeah,
I don't even know.
Irish or something. It's something. Yeah. It's I don't know. I never really, the sentiment never really made sense to me. May old acquaintance be forgot. Like, that's kind of shitty.
Yeah, why would you want to do that?
Right? May old acquaintance be forgot.
Yeah.
Fuck them. Yeah,
shouldn't be the other way around.
Let me meet new people.
I don't have enough acquaintances to forget that.
I'm trying to remember everybody.
I can't afford that.
But here we are in 2022. Everybody putting their best foot forward after hit or miss 2021. We're right back. Nothing's really changed. In fact, in some cases, things have gotten worse. We're going to cover all of that this evening with our guest, Dan Skinner from Prognosis Ohio, which is a podcast about health and health issues in the state of Ohio. So we're going to cover a lot of those issues. Welcome back. You were on the podcast before with our friend Jesse Hubbard and his father when we were talking about prostate cancer.
Yep.
And we had both of you on because I'm sorry to say that Jesse's dad succumbed to it eventually. He's left us, but you had your bouts with that nasty little fellow as well.
I had the testicular cancer.
Yes. He was a nice man. That was a great podcast. It was a great podcast. That's right. You're the one ball wonder. Mm-hmm. Right?
Yeah.
We discussed that on the.
I've got an extra one if you want to borrow it.
and other ball jokes. If you need them.
Yeah. No, I don't. We don't need one. I think one's enough. But for those of you who want to know that story, go back to the archives and relive that little story with Dan Skinner.
That was like 2019, I think, before the pandemic.
I think so.
Yeah.
Maybe November 19, something like that.
Yeah. We had no idea.
No idea, but it was a good podcast. It was informative, and it was sweet, and it was sad, and it was I don't know, kind of like a little bit of everything on that particular one. As opposed to this one, I don't know what this one's going to be. I really don't, man. But thanks for being with us. And also, congratulations. I'm going to get to the business and the guest bottle here in just a second, Hansberry. But I wanted to say congratulations to Dan Skinner, who recently recorded his 100th podcast of Prognosis Ohio.
Nice.
So congratulations.
Thank you.
Cheers. Way to go.
All
Nicely
right.
done. Nicely done. Hey, look at us toasting whiskey on a health on a health podcast.
I knew what I was getting into.
Oh, this is good.
Has it turned out to be everything you expected it to be?
The podcast in general?
Yeah.
You know, Hansberry will remember this. I had been told by some people, you should start one of these, conversations about health and healthcare. And I called him up and made him meet me for a coffee. And I said, true. I was just filled with anxiety. Like, how do I do this? What, blah, 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 blah. And he was like, just do it.
Just do it.
Just do it. Just start talking, and people start listening. And it's worked out pretty well. I've had to learn a lot, but man, there is no shortage of stuff to talk about in Ohio with health. So, it like every week it's just like, oh yeah, obviously there's like 1,000 people I want to talk to, and
that's great.
They've been willing to talk to me, so that's cool.
That's amazing, and the podcast is very well respected and very well reviewed, I might add.
Well,
so congratulations, and here's to 100 more and then some. Our guest bottle tonight is courtesy of Greg Hansberry, everybody. It's the Wild Turkey Rare Breed Barrel Proof Rye that he purchased when he was down in Kentucky.
Yeah, shout out to my cousin Ben. He was like talking. We were down there in Bardstown, where it's the Mecca, and he kept talking about this. And on the way out, I found it at a liquor store down there and bought it. You can buy it in Ohio, though.
Yeah, you can.
But it's I've already had a little bit of it. You guys have had a sip of it. It's
I've had it before, but this is a non-chilled filtered rye. And this one's barrel proof, so it's got a little kick to it.
It's 112. Yeah,
it's got as I recall, it's got a little. It's spicy. You pick up a lot of spice and a lot of little.
I'm waiting for this ice cube to melt. I bet it's gonna
peppery. It'll change it up a little bit. You'll notice that because it's non-chilled filtered. You'll notice it'll get a little cloudy.
Okay.
And that's because they don't. That's the beauty of the non-chilled filter. They don't take any of the stuff out. All the congeners that give whiskey its flavor, everything stays in there, and that's why.
I feel like I'm hanging out with Bill Nye, the science guy. Right
now. I was horrible at science. I still am. But when it comes to whiskey, I know a little bit.
Is it true that those contribute to your hangover, or is that just?
There's some debate about that back and forth as to whether or not that's true.
If you chill filter it, you don't get the hangover.
If you chill filter it, you don't get the.
Yeah, that's what I heard.
Right. Have you ever? You've had a lot of whiskeys that have been chill filtered.
I've gotten hungover.
You've gotten hungover. So what do you think? I don't think it's got anything to do with chill or non-chill. I think it has a lot to do with how much freaking whiskey you drink before it's all said and done. It's appropriate that you came up with Wild Turkey because that gives me a chance to do a shout out to my brother-in-law.
All right.
Who gave me a bottle of Wild Turkey 101. Just your everyday bottle, okay.
Right, yeah.
But it was the Christmas bottle he sends me every year. It's up there.
Is that right there, Johnny? Can you grab it for a pick?
It's up there. It's up there. See the Wild Turkey 101? Yep. Careful. Don't drop it. Yeah. You know what? Leave it alone. Leave it alone. It's okay. I can just tell you.
Just reach a little bit.
I can just tell you.
Here, get that broomstick and try to get it a little bit closer to you.
I can just tell you that it's signed by the man himself, Jimmy Russell.
That's awesome.
So that's a pretty cool bottle. So
that's great.
That becomes that'll be a bottle that won't be open.
Sure.
Because I always say that you got some great bottles here, and I've opened up some amazing bottles here that if you were to go with the value of said bottle, worth hundreds and hundreds of dollars, I've opened them. I don't care.
Well, and that's what's cool about it is you know what that tastes like, or you could go buy it.
Yeah, Wild Turkey 101. I can go buy. This is like $19 a bottle.
So you're like, I wonder what that tastes like.
But to have Jimmy Russell's signature,
that's
on
awesome.
There.
Look how pretty that is. He's good at that.
Yeah,
and like a gold Sharpie.
Yeah, he's signed quite a few of them.
So wait,
he's got it down.
Really embarrassing moment, but.
Who's Jimmy Russell?
Yeah. Come on.
He is the man behind the Wild Turkey.
Yeah. He's like the head distiller.
Should have just guessed. But
he's
I'm honest.
He is. That's okay. It's okay. You're right.
The great Bambino.
We shouldn't.
The Sultan of SWAT.
We've met him. He's shorter than I thought he'd be. Actually.
Yeah. You're taller than I thought you'd be.
You're taller than everybody. Oh, man. All right.
Let me hit this real quick.
Hit the business real fast.
Subscribe to Whiskey Business on your favorite podcasting app. Thank you for finding us here in 2022. You should make it your New Year's resolution to listen to all of our archived episodes. Find us on Facebook, Instagram, Twitter, and YouTube, Whiskey Business with Dino Tripodis. John does an amazing job of editing all the videos so you can watch it. And listen to it or watch it, do whatever you want to do. Also, thanks to Evergreen Podcasts. That's our network who has
that's our La Familia.
Graciously,
who has brought us aboard.
Whiskey. That's evergreenpodcasts.com. You can find more info on us and all of our brethren.
I meant to tell you that they just kicked off a kids network.
Oh, no kidding.
Evergreen.
All right, I'm going to have to hop in.
Podcast for kids.
All right.
And I know you got a lot of ideas for kids podcasts, so maybe you should talk to the powers that be.
This is where I say, I work with a child every day.
Work with a child. You work with a.
And just to be clear, this is not a kids podcast.
This one is not. This is not a kids podcast. No.
Crossover.
But Evergreen's been really good to us, and they've been picking up awards left and right for a lot of the folks that they have on their network.
Yeah, this will be great. I'm glad to be part of it.
Someday we'll be one of those people that'll make them proud. Someday get an award.
Come on, you guys won awards. I was actually thinking I was going to maybe abscond with one of those awards.
Oh, we've
tonight.
got a couple of them.
It's like, can I get into the inner sanctum and boost one of those awards?
Yeah,
sure.
Columbus Podcast Awards.
We'll let you borrow it. Take it on a date.
You can have it. It's just good. Like
sleep with it.
It'd be like,
Like
the
the
Stanley
Cup.
like the Stanley Cup. Right? Let it travel from podcast to podcast.
Just drink beer out of it.
Okay.
All right, man. I got a lot of questions. I got a lot of questions for our guests, but you know what? I'm going to start things off a little bit differently because I have a lot of questions. But I bet as you were coming over here, you probably had an agenda as well. There was probably stuff on your mind that you wanted to talk about on Whiskey Business. So let's flip the tables for a second and let's start with you. What do you want to talk about in respects to health issues in the great state of Ohio? Because I know I'm going to get to the things I said in the tease. I want to talk about Omicron. I want to talk about the fact that we're the 4th or 5th largest infected state in the union, and some other things as well in respects to longevity. But what do you want to start with?
So one thing really quickly, I was
Yes.
watching, I think it was MSNBC today. It just had it on in the background, and I noticed there was a map. The entire United States is experiencing what they called a spike, but Ohio and New Hampshire were the only upticks. And I thought, well, that's something. I mean, I'm pretty proud to be an uptick
You want to be an uptick?
and not a spike.
And not a
So,
spike?
Now,
What's the difference?
I have no idea. And
Is it lesser than a spike?
It's lesser than a spike. It's better
Because
than
we
a
already
spike.
spiked last week.
Yeah.
So there's like 1 point versus 5 points or something like
Now, granted, we're probably just going to follow the other states, and we're going to spike next week, and we're a little bit behind the scene. But I thought that was, I thought that was okay. I guess what I want to ask you guys is, when you think back to March 2020, and not to like PTSD this whole episode or anything, but we were all sitting around being like, all right, by June, be back, everything be all
Everything
right.
will be okay. Well, yeah,
Back to normal.
Like, we had no idea. In fact, I did a podcast episode with the Franklin County Health Commissioner, and he and I were talking, and we were like, get your flu shot, wash your hands. Everybody calm down. We had no idea, and he's somebody I admire tremendously. He's like, public health people were trying to figure out what the hell was going on,
Right.
and doing their best, and don't wear masks, wear masks.
Yeah, that was crazy.
People shopping in gloves, I mean,
Wiping the groceries down.
right, like all this stuff, just trying to figure it out. And I don't think any of them were ill-intended. Everybody was just trying to like figure out what the fuck this was. So there's that. But also, this is a podcast not about whiskey, but with whiskey.
Right.
See how I did that?
He knows the catch line.
Like, drinking's been a constant conversation through the podcast. And I don't actually know. I've listened to many of your episodes, but I haven't encountered an episode where you really address that specific issue of like, to what degree is the subject of drinking, really threaded through this pandemic?
We've touched upon the fact that our consumption has risen. And yes, it is a podcast not so much about whiskey as it is one with whiskey. We've had one podcast, and way before the pandemic, we had one podcast that had no whiskey on it whatsoever.
Yeah.
And that was when we interviewed a friend of mine, Matt, who was an alcoholic.
Yeah.
And he told his story.
Yeah.
And we thought it appropriate not to have whiskey. He didn't care if we did or not.
Right.
He wasn't going to drink. It wasn't like we were here. Are you sure? Are you sure you don't want? No, it wasn't anything like that. And that was the one podcast where we didn't have any whiskey. But it's interesting. We've talked about it, but we haven't talked about it seriously.
Yeah.
We've joked about it. Oh yeah, everybody's been boozing it up a little bit more. Statistically
Wine, do it
speaking,
with the wine.
everybody.
Our coworker today had a good point. We're talking about the kids, and that's one thing I would like to talk about today. But just the stress of the kids. But adults have the liquor. We can go stop at the bar. We can drink a bottle of wine. We can go to the garage and sneak a bottle of whiskey or whatever. But the kids, they, you know what I mean? Like the whiskey or the drinking it's for good or bad or whatever, however you would say it, has been a quote unquote an escape mechanism that the children have, but we sure as hell take advantage of it.
No, right.
Whether it's healthy or not, we're using that.
That's what I said on the show this morning. What do the kids do? Get another juice box?
Right.
Oh man, the one's not cutting it. I need another juice box.
Exactly right.
Well, look, I have an almost 7-year-old, and I'll say, one of the things I've learned throughout this, the kids are way better than us at this, right? I mean, now we're really worried. I mean, it's now been almost 2 years, and we're talking. That's a pretty substantial chunk of a childhood,
Sure.
right? Like,
when you're only been alive for 6 years, it's,
Right.
you know,
It's huge.
No, I mean, yeah. So it's, kindergarten on computer screens, which was kind of our experience for a good deal of time. It's ridiculous, right? This was my son's gym teacher asked us to buy jump ropes and he's in the room with a fan, and like the kids are not going to be jumping rope at home, and that's not going to happen. Like everybody's trying to figure things out as they went through it. Just absolutely ridiculous. But you know what? These kids, they put their masks on, and they did it. They didn't complain. In fact,
Right.
like now it's cold out, and my kid, I walk him home, I'm like, you don't want to take your mask off? He's like, no, it's keeping my face warm. Like,
Oh, yeah, that's a good way to
like
look at it.
Yeah, they are not.
Wow.
But meanwhile, you have like these politicians in Ohio who are like whining about it and yelling about freedom and like George Washington or whatever. Like these people are absolute babies, and meanwhile, kids are stepping up and they're just kind of rolling with it. And I think that's a real important lesson for us. It's just what babies, adults have been through this.
right.
When actually this was pretty simple, and we could have had this thing not like nicked, but like we could have
Probably
been in a better position.
maybe
than we
not
are.
not beaten it, but slowed it down. Maybe
Been a
curbed
little
it
further
a
along,
little
yeah.
further along in the process. Maybe not so many people infected. Yeah, you're right. You're right.
And I'll say, I'll
the
agree with
kids
you,
are far more resilient.
because
And
my daughter's almost 7, so about the same age. And
should hang out.
and they don't really know. She's never been to kindergarten. She doesn't know that she's missing this awesome circle time, and let's sit around in a circle and touch not each other, touch like touch the same toys and
Kindergarten
eat glue
equal.
and whatever. But my older son, he's 9 and he's in 3rd grade. I've seen now.
Yeah.
It's starting to affect him 2 years
Yeah.
in, because he's like me. He's fed up with it. So I don't know. I just think there's an age limit that maybe,
Now, with the drinking piece, though, what I
Yeah.
want to say is that, like, I think there was a period in March, April, May where, Hansberry just mentioned wine with DeWine.
Yeah.
And sort of we were making these comments about, like, oh, like, we're all home and we're just, like, trying to get through this. But then came the serious conversation about consumption.
Right.
Came the serious conversation about, I mean, I've talked to several alcoholics who were reflecting on sort of what it's been like for them, and they were very thankful that they were sober already, because like that was helpful right at that
did you
time.
talk to any that fell off?
No.
No. Interesting.
Have you?
That fell off the wagon? No. No. My friend Matt would be it.
I don't know any
No,
sober.
my consumption increased like everybody else's. But what I found it to be interesting is at one point, and it was probably the middle of last year, I just I think I'm done.
Yeah.
Not done, done as far as the excessive consumption or the extra consumption. At one point, I just go like, I told my friend, I go, dude, I think I'm whiskeyed out. Yeah. I got to a point where it's like, this isn't fun anymore.
Right.
Well, I think we all hit a point where, I mean, I did anyway. I'll speak for myself. There was a point where I said, oh, fuck, this is real. Like,
Yeah.
this is not going to be 3 months. This is going to
Right.
be a year or 2 years. I need a strategy for living.
Right.
And, like, that was a different framework than, like, kind of, a month at home or something like that.
It was a little novel at first,
Yeah.
Yeah.
And we are now in the phase of, has this fundamentally changed our world forever? Right? Like these are now existential questions when they were like seasonal questions, and I'll be back on the beaches by July or whatever. And then now we're talking about, whether there's going to be like a sports season or whether we're going to have schools open or whatever.
Yeah. It's for me, it was just, there were friends we were all a select group of friends that were in a bubble, and we congregated and we drank, and we drink a little bit more than usual. Yeah. But at some point it actually, I never got to a point, thank God, where like, oh man, I can't wait to get a drink, and that's never been an issue for me with alcohol. I don't pretend to know what it's like to have a drinking problem. I don't know. I don't know, because I don't have one. If I don't have a drink tomorrow, I'll be just fine. And I don't know what kind of hell that is for people who can't do that.
Yeah.
And I hope to God I never have to go through that, because it seems to be terrible, and I've heard it through my friends who have had that problem.
Yeah.
So yeah, now I'm back to where I've always been. I just enjoy it. I enjoy the nose, the palate, the taste of it, and so forth and so on. And so yeah, it's been interesting. It's a great question as to how much has drinking changed, has our drinking habits changed.
And then, you're still talking about. I mean, my wife's been working from home, so luckily she's not a lush, or else, I think, the opportunity is there for you to sink into a deep hole. And
my consumption's gone up, but I always keep it between 6:30, 7 o'clock in the evening. I always quit at 10.
6:30 a.m.
He's got a schedule.
I got a schedule.
but I've seen that from knowing, alcoholics in my life, but also policing myself.
Right.
I've never been. I love a good drink.
Sure.
But if I wake up and want to drink, that's a different game.
That's a whole different ball game.
To me, and that's where I've been seeing a big difference. I mean, one of the things that happened, and we've been talking about this on the podcast, and this has also come up in my professional life. I think even the last time I was here on this show, we were talking about the opioid addiction crisis and things like this. And, I had worked on this book, and I'm involved on the state level with this kind of stuff. And totally wiped off the map in March 2020. Just like, wait, opioid what? Right?
Right.
And not just opioids, I mean, methamphetamines and addiction generally and all that stuff. And then, a couple months later, people started being like, we know this is a huge problem. We've got to start getting back to looking at, and lo and behold, right, then 2021, the data started coming out and just through the roof.
I bet.
People who were already struggling with addiction were completely unknown. They were indoors. They were dying. They were suffering.
Yeah.
And we weren't thinking about them. And the state and local municipalities started kicking back into high gear and thinking about that stuff. So yeah, the COVID pandemic had the ability to kind of wipe things off the agenda.
That's interesting.
No, it's interesting.
Push everything to the back.
Yeah, it's interesting, but I totally believe it. In fact, I think when we said, and I apologize, I said the next time we have you back, we were going to talk about the book and so forth and so on. Now you get a third appeance when we come back and
I'll
talk
remember
about
to ask you at the website at the end.
Talk about the book and that thing, because I watched. Well, you watched it too, Johnny.
Dope Sick.
Dope Sick on Hulu, which
Fucking
was just
it just pisses me off.
Yeah,
I wanted
it
to go out and
was
beat somebody up.
Just
It's ridiculous.
great.
Oh, fantastic!
Great show.
Is it a docu? I don't know what it is. Docu-series? Is it fictional?
No, it's based on.
It's based on facts, but it's
Fictionalized.
It's
Yeah,
dramatized.
it's about
Michael
Purdue
Keaton.
Pharma.
Michael Keaton.
Oh, okay,
fucking
gotcha.
crazy.
Yeah,
Is
yeah,
great,
yeah, yeah.
and it's just it really does. If it pisses you off.
Did you watch the whole thing?
Yeah.
Finally.
Yeah.
Oh, it's just so sad, man. It makes you so angry that a company would do that to people, just for profit. It's nuts.
Yeah. So, that issue is still there. It still needs to be dealt with, is being dealt with in some ways. But, something like a pandemic exposes, any cracks that are in our society, any things that can be exploited will be exploited.
And in a way, that's a good thing, right?
You hope so, right? So, but one of the things I've observed, I started taking some notes early on in the pandemic about some of the policy discussions going on in this country, and all the Medicare for all people, right? I'm sure your listeners know about this is the Bernie Sanders kind of movement, right? We're going to have a national health insurance program. There are all these Medicare for all people in April of 2020, and they were like, finally, everybody's going to see.
Right?
How broken this system is. They're going to see it for what it is. It's going to be totally exposed. The polling hasn't moved a single percentage point. We've learned nothing from this pandemic. That's my most depressing thing to say tonight.
So that's one of my questions for you. Where we stand right now with the state of COVID, Omicron,
Wrap it up.
Delta virus, and whatever else is coming up next, do you think our biggest issue as of today and moving forward into tomorrow, do you think our biggest issues are they political, are they medical, or are they, in respects to the public, cynical?
Yeah. Look, I'm a political scientist, so I'm going to say political.
You're going to say political.
To me, this is a lack of social connectivity, cohesion, caring for one another. It's selfishness, and that gets refracted through things like like, we're in the middle of a pandemic, and what's our state legislature doing? They're as busy as they possibly can, especially on the Republican side, which controls everything here, trying to pass every bill they possibly can to make sure that if another pandemic ever comes, we're still dealing with this one.
Yeah.
But just in case another one ever comes, there's no tools to deal with it because freedom. And you're like, you guys are just the most, it's absolutely tone deaf. And they are pandering to various constituencies, but they're also just out of their minds.
Yeah.
I was watching some of Dr. Fauci at the hearings. I thought at one point he was just going to get up and smack
Oh, no
somebody.
shit, dude.
I really did.
Yeah.
I really did. I mean, it's like, it was just like,
He was pissed.
I'm watching this. I'm going like, okay, this is real.
Yeah.
This conversation is actually happening. Into our third year, this conversation is going on. This wonderful little man who's been fighting tooth and nail every step of the way.
And you said, I'm surprised he's still here.
Yeah, I am.
That's what you took away.
I'm surprised. I'm surprised.
Thank
he
God
hasn't
that
He's a public servant. He's
Yeah.
not going to
I'm
leave.
surprised he hasn't gotten up and said enough. Which brings me to my other question. Is like, all right, so the biggest issue you say is political. Medically speaking, I think we're doing everything we can. Obviously, hospitals though, as we speak, are overrun and overcrowded.
Yep.
But the cynical question is: do you think that we, as the people, have gotten more cynical in the last 2 years and have this streak of cynicism running down our back in respects like we're like you mentioned earlier with the kids and everybody else, we're tired.
Yeah.
We're just fed up.
We're just
Well, I think that's the thing. So and it makes a lot of sense. And this is a thing that doesn't even have a partisan kind of like core part of it, right? Everybody's exhausted, so you can understand why people get wound down after a time, and they're just tired of it. But if you go back again to March and April 2020 in those early months, there was a sense of like, let's whip this thing, like let's take fast action and see if we can do this. Didn't work out that way. Now the whole world is struggling, so it's not like you can
Right.
point to Ohio and be like, "Wow, you guys suck." Like, yeah, Ohio sucks in many ways. Like, we can talk about those ways in which we're behind in certain things, but like the whole country is suffering. This is a pandemic. Like, Fauci has said this. We've never seen anything like this, right? And this disease is wily. It's mutating. It's doing all these things.
I've used the example of dodgeball. Right now we're playing freaking dodgeball as far as who's got it and who doesn't have it. And it's like whether you're vaccinated or not, whether you're boosted or not. It's just like, it's like.
But-
I saw this performance art. When you go to like Vegas and they've got like the Taekwondo performance art.
Yeah.
It was this guy with this like spear, and these women doing like flips and dodging it. It was hilarious. But it basically was like
Yeah, but that's
mid
the way-
dodging,
that's the way it
dodging.
feels.
But that is a different question than how we treat each other and how much we care about each other.
Right.
And to me, that's the thing that depresses me, is that there are people in this state who just don't give a shit about other people.
Yeah.
They will, bang pots and pans or do a flyover at a Buckeyes game to celebrate health professionals, but they won't do the simplest thing to keep their loved ones out of ICUs, to release the pressure a little bit on nurses and physicians and other people who are working away in these hospitals. They won't do the basic things, and that's, to me, unforgivable.
Selfish.
Yeah.
Do you think separation because of what's happened in the last 2 years is like eroded away empathy?
Oh, empathy's been being eroded from this country in so many ways, and
But
so
it's
many
made it
different
worse.
levels.
I think it's made it worse.
Yeah, I mean, you can't make people empathetic. But what you can do, and this is kind of my job, which is why I have a fun job as a teacher. I get to just basically expose hypocrisy. Be like, so you claim on this hand to be Hippocratic and this and this and that. On the other hand, you're doing this. Like, if there are these massive inconsistencies in your life where you claimed we see this with all sorts of things, patriotism. Support the troops, blah blah blah, stand up for the national anthem, yada yada, but like, don't fund the VA.
Right.
Like, to me, those are the kinds of things you can just look at the two things and be like, what does it actually mean to support somebody? What it actually means to support somebody is to do something tangible that makes their life better. Not to thank them, not to send them a card or bang some pots and pans together, but like do real things. And this is what I see too much going around our state, is just like this, garbage symbolic stuff, slogans and, hanging flags out, but not the things that actually make people's lives more livable.
So when you go, I'm going to go back to something you said earlier. You won't do a simple thing to ease the burden of the people who are working in hospitals and so forth and so on. Why do you think that is? Why, in your opinion, why do you think those who resist and fight and don't want to get on board? What do you think their reasoning is?
Yeah.
And then once again, it goes into the political. You said the flag waving and the pot banging. Oh, it's America, freedom of choice, so forth and so on. When it's something that trying to save your life, and you're saying I'm stupid. I'm not stupid for wanting to try to save your life. Am I? But you're making me feel stupid because I know people who aren't vaccinated.
Yeah.
I know people who don't want to get vaccinated.
Yeah.
And some of these people are friends.
Yeah. No, and me too, and family, and it's been very hard. I mean,
It's like, why are you yelling at me? I just don't want you to die. I'm not going to die.
Yeah.
You're going to die.
Yeah.
Okay. All right. Yeah. Well,
we have a lot of data suggesting
we're all going to fucking die at some point. I just don't want to die of something that I actually had a chance to control.
At 62.
Yeah. I mean, I tell people they're going to die all the time. I think it's an excellent frame to start conversations.
Yeah.
Look, it's torn apart families. It's torn apart friendships. And I don't have an answer for that. I mean, Dino, you've been around a little bit longer than I have. Mm-hmm. I don't know if you've seen anything like this. I've studied history to a point where the disinformation, and frankly, I mean, I'm willing to play around with language that I didn't used to like getting into because it sounds really paranoid. It sounds really conspiratorial. But like, man, people are under a spell. They do not believe in very basic things where you have data showing you're likely to die.
Right.
Like I'm sorry. Like I know that you think that I'm making that up.
Read. Here it is.
Yeah.
Right.
Yeah.
It's right here. Oh, that's bullshit. That's crazy. That's I hate the term. I'm so sick of it. That's fake news.
No.
I'm tired of the fucking fake news.
Yeah.
In my course of my life, I am a little bit older than everybody in the room, and I've seen through the decades, I've seen political divisiveness galore ever since I was a kid. But this type of medical, how divisive we become over this, no. I don't think I've ever, when I was a kid and I had to get inoculated like everybody else.
What was the thing that gave everybody the little scar?
Right there.
Yeah, what is that? What was that for?
What was that?
My mom, both my mom and dad have that little thing.
Yeah, I got it
What is it?
somewhere.
Yeah, right there. I
Yeah,
see
Right
it.
there it is.
What was that?
It's
What was
right
that?
there.
Chicken pox? What was that for?
No, it's for
Measles, mumps, scarlet fever.
no.
I don't know, but it was good for me.
But that's the point. Is like you don't even
We
know now.
question it.
You did
Yeah.
it. But I
polio. It was a polio shot.
I tell my kids, well, March 2020, April 2020. I'm like, kids, this is crazy. You're gonna grow up telling your children about this, right? Mm-hmm. But it's just keep going on, and I'm almost worried that this is just gonna be the start of a bunch of bullshit that they're gonna have to deal with for the rest of their lives.
This is so much different than the polio shot because this is so politicized. Back then,
Exactly. You just
I
got
remember when I was in second grade, lining up in the giant hallway in my school, and everybody just got in line, and we all
At
got
school,
our polio.
you did it.
Everybody got our polio shot, and it wasn't political at all because everybody accepted that there was a problem, and this is how you fix it.
It wasn't just not political. If that's, I don't know how many negatives that is, but it's not that it was just political.
Well, you know what I mean.
It was patriotic to
Right.
be
Oh, yes.
inoculated.
Yes.
Right, and that's the thing where I want to call bullshit on all sorts of people. Say, you guys are the ones waving the flags and saying how much this or that. Like one of the things I've noticed, for example, is a lot of, and I know this is not a political podcast, but
you know what? We go wherever it goes.
sure. So they can all blame me here on this one. But
Especially the more 112 proof whiskey we'd start drinking.
there's been this interesting movement in the United States over the last couple decades where a lot of right-wingers in the United States talk about how much they love Israel. I stand with Israel. I support Israel. Israel's great. All this kind of stuff. You know, Israel has one of the most dynamic national vaccine mobilizations right now. It's super impressive. I mean, they have inoculated, more. I think it's more than 90% of their population. Now they're still getting walloped because like this disease is a monster. But like, can we talk about that? Right? Can we talk about the fact that there are some examples of countries that have really taken it seriously? Now, there's also like horror stories. I hear some of the stuff that China's doing in preparation for the Olympics. It's pretty bad.
Yeah.
Right. So
God.
like, and Americans are involved in this conversation of balancing like liberty and public health and trying to and that's all a really good conversation to have. What I hate is the lying. What I hate is the dissembling and the dishonesty.
But who's to say who's lying and who's not? I'm trying to be objective here because that's what you're dealing with.
Yeah.
You're saying you're sick of the lying, and what you consider to be lies, someone else is going to like, that's not a lie. Yeah. That's the truth, goddammit.
Yeah.
They're lying.
Yeah,
Dino,
they're lying.
Yeah.
So what do you do about that? I mean, you know.
We were saying this before we started recording today. When you go to your doctor, luckily we have learned, I think most of us, when we go to the doctor, I think 20 years ago or 30 years ago, you go to the doctor and they say something and you say, yes, sir, okay, or yes, ma'am, I'll do whatever you need. We now have become more skeptical and we know to ask more questions. We know to get second opinions. We know to be, we're a little more critical of that kind of
That's different than being defiant.
Well, that's my point, is that there are people who have studied a lot of things for a long time that we know nothing about. I'm a health policy professor at a university, pretty good one. I know nothing. I literally don't know what a pancreas does, like at all. Now, I mean, maybe exaggerating slightly.
But I get what your point. What your point is.
We were talking about the thyroid before we started. I have no idea what a thyroid does. It sounds ridiculous.
You're asking me about my health. I said I got a little bit of a thyroid issue.
So you're a poli-sci guy that works at the hospital at Ohio State, right? Or at the school, right? Or I got it backwards?
No, I work at Ohio University at a medical school. But
all right, never mind.
Nice try, though.
I'll cut that out.
He's wearing a hoodie, for God's sake. He works at OU.
Yeah. The point is that you're a poli-sci guy that works at the hospital, in the medical section.
Yeah, so I teach policy, but like what I'm saying is I have respect for people who have studied medicine, right? I have respect for people who understand climate, right? Like the climatologists and people who have actually put the time in learning how to read the equipment that tells us what the hell is happening. The disrespect for people who actually know things. Like, I'm not going to come in here and like try to one up Dino Tripodis on broadcasting.
It wouldn't take much.
Well, but
pick something else.
Raise your bar a little higher.
The Rat Pack.
But I do think it's worth it. And like I'm one of these. I don't know, sarcastic types who likes to challenge authority and all these kinds of things in my life. But I have a lot of respect for people who know things, and there's just absolute disregard. You talked about Rand Paul and Tony Fauci. Now, Rand Paul, by the way, is a doctor somehow.
I know somehow he is. I keep forgetting that he is a doctor.
Yes, and that makes it even more disturbing.
A doctor of what?
Ophthalmology.
Oh, well, that makes him an expert.
Oh, yeah.
Well, he still had to go to medical school. He still had to go to medical school.
Not for 12 years.
I'm sure he's a fine ophthalmologist, but man, that does not translate to anything of any value to our country at all with him as an elected official. So like this disrespect of people who actually put the time in to learn things, we all need to check ourselves a bit and say, I don't know shit about X, so I'm going to have to listen to you and take it seriously. What you have is a lot of people just like flapping off about stuff they don't know.
Or they're trying to get their information from shitty Facebook websites or whatever it is to argue their point. You know what I mean? They're not going to Grey's Anatomy.
It's interesting, and it also comes down. It's like when you're. This is a ridiculous example, but it's like when you're trying different foods. and there's foods that you've never had before, and you decide whether or not you're going to like something, or whether or not you're going to try something, or whether or not something sounds intriguing or interesting to you to eat or to experiment with, or if it's something that someone says, I'd like you to try this rare fish from Japan, and you go, you know what, that doesn't sound very good to me at all. So when you think about stuff like that, when I was reading all the stuff all these cures for COVID, the drinking of the bleach and so forth, that's like a Japanese fish that I don't really want. That doesn't sound right to me. But then I would read medical journals that came from France that said that cigarette smokers are less likely to get COVID. And I'm like, well, I smoke cigarettes. I'm on board with that. Okay, I'll keep smoking. Whiskey drinkers, less likely. Not saying you won't get COVID, but less likely to get COVID. So it all depends what you want to buy into and what you want to accept as, well, maybe that's okay.
Yeah.
Maybe that'll work. Okay, do I think that whiskey's going to keep me from getting COVID? Not really. But
not really? No. I mean, let's be very clear about that.
Not really. No, I don't. But I think that continue to smoke cigarettes and keep me from... No, I'm not. But I read the studies, and I'm like... Well,
someone somewhere also agrees with you.
What my point being is that someone, everybody, all that did is became a rationalization.
Yep.
Yeah. Oh, I'm not going to quit smoking. I just read an article the other day that
just like diet plans.
Cigarette smokers are less likely to get COVID. Why should I stop smoking?
Funded by Pall Mall.
Or 7 cups of coffee keeps you skinny. Oh, okay. I'll just start drinking coffee.
So one of the things I think it's worth saying is scientific literacy, like basic science literacy. So when you look at like somebody who says, it's just a theory.
Right.
Well, look, gravity's just a theory. It's a damn good one.
Yeah.
Right.
Prove me wrong.
But
right?
but that doesn't bother scientists to talk in that way. But the average person today, what's happening is they hear like, well, there's a 20% chance or this, or like even the evolving. I mean, and I think this is a really important thing to be a little sensitive about. It's true that the science has evolved in real time during COVID. In the very beginning, they were telling us not to wear masks.
Right.
Now, it turns out that there was a mask shortage, and they were trying to make sure that like medical
Doctors
professionals
had masks,
had N95 masks, and now we don't have that supply chain issue. So like that's changed, and they are taking into account things like scarcity, right, and making sure that the right people can get the right things because we're trying to do the best we can. And it's true that COVID, we didn't understand really anything about this at the beginning. Is it transmissible in this way? How transmissible? What kind of mask is it going to be? How long is it going to live on our clothing? When like all this kind of stuff.
Right.
And you can't blame, most people who don't have any scientific training for being confused and a little angry that the ball keeps moving on them. But and we do have to keep an eye out for true scoundrels in all of this.
The whole mask thing,
Scoundrels.
Whether or not to wear a mask or to not wear a mask, I never bought into that at all. When they said start wearing a mask, I wear a mask because, and once again, simple logic. Like, all right, if I'm in surgery and I'm on the table, and they're operating on me, they should all be wearing masks.
Yeah.
And that was the kind of logic that I used.
We've all seen ER.
I want them to be. I don't want somebody with a cold if I'm having surgery, or, sneezing or coughing on me when I'm having an intense surgery. They're wearing masks so that was my simple step.
Yeah.
How bad can it be? And we saw that the cold and flu season that we normally have dropped dramatically when people started just applying simple hygienics that they had not maybe been so diligent about, washing their hands on a regular basis, the mask wearing. I mean, cold and flu season practically was nil. In that first year of the pandemic.
But we can't we can't downplay how shitty it is, right? Look, we're here having a conversation. We're all vaccinated. We did like due diligence before we had this soiree to get together, and we're sitting
I'm sitting
little
closer to Dino for the
right.
record.
Well, you stay there.
My face is about 6 feet away from
Yeah, that's appropriate. So, but you know,
I'd like it to be closer to mine.
I
But as I'm talking to you, like, and this is with teaching too. It sounds maybe it'll come out the wrong way. I love seeing your mouth while you talk.
Yeah, I get that.
It's helpful.
I get that.
And I enjoy it, and having a conversation is much more enjoyable like that. So this has really sucked, and people are expressing that. The problem is that it's been turned into this like, well, they're lying about this. No, science evolves. Science like changes over time as we understand something, and I just want to give. You know, I mean, people like Anthony Fauci or, you know, Rochelle Walensky at the CDC, these people don't have... I mean, I would love to be the head of the CDC and be
would
like,
you?
you know... I mean...
Would you really right now?
It'd be a nice resume item. I don't know, right, to say, hey, I would love to have been that.
You get so much tail.
Right.
So... What? So... But, man... these aren't easy jobs, and these people don't get paid a ton of money. I mean, they get paid well, luckily, better than I do.
Well, look at Amy Atkins. Death threats, people walking around with guns.
So I think we need to back off and be like, if we want quality people in quality positions, we need to give them a little bit of flexibility to talk to us honestly about things without, like, gaslighting them constantly. And, freaking out immediately when something changes. But at the same time, people are genuinely trying to figure out how to live their lives. And there's this movement in public health to, quote unquote, meet people where they are. I'm pretty tired of it. I want them to get to where we are a bit more. Right. But, they're not going to come along. So we need now to figure out, well, how many days of quarantine are we going to, reasonably expect of people? They're going to leave. Right, we learned, for example, I'm in Grandview. We learned, and many places learned this, that if we kept the kids home from school, right? Well, the little kids, you can kind of keep them home, and they're gonna terrorize Hansberry or whatever.
God,
but and me, but the high school kids, they were all partying in basements and there was shame attached to it. So nobody was talking about it, but we knew that these kids were hanging out in basements and doing their things, playing video games and all that kind of stuff. So what's better? Well, now there's this push, and I think there's some wisdom to it that having kids in controlled environments, aka schools, is actually a place where we can know what the fuck they're doing.
Mm-hmm. Yeah.
Right. So
as much as you might bitch about the schooling and the whatever, at least you know what where they are.
Yeah. Yeah. So the controlled environments, places where we can. This is true at Ohio University. It's the same thing. We know that if we move to hybrid or online, they're all going to go to Athens anyway. And they're going to be in their on their computers for their classes, and then they're going to go out and do whatever. Mm-hmm. But at least when they're in their classes, we can make them wear masks and and do certain things. So we're learning a lot about this, and I'm still hopeful that we can get something out of this. But man, so far I don't see a lot of learning happening.
I just got to bring it up because I keep getting reminded. Have you seen Don't Look Up?
Mm-hmm.
Yes.
If everybody at home who's listening to this podcast,
love that movie.
You gotta watch this movie. I've been raving about it for a minute. It just it's a great film, but it just has all these hilarious reflections of what's going on. And you mentioned the scientists don't want to do, they don't want to say everything's 100%. And there was a scene where he goes like,
the president?
Yeah, he was like, well, there's a 99.9% chance. And she was like, all right, we'll call it 70%.
Right.
But anyway, I don't have any other point except for to make that. The more that we talk about this, the more I keep thinking about that movie. I love that movie.
Yeah. The fact that there's the ever-present spin factor, because
exactly.
As crazy as this all is,
That's
politically speaking, medically speaking, it's also become part of our culture, and as a result of something becomes kind of part of our culture, becomes part of our, and I'm not trivializing it, but part of our pop culture. I mean, look at the names we got. We got the combination of flu and coronavirus. We got the Flurona. Now we're coming up with all these cute little names. We got the Deltacron. I mean, these things become the Deltacron, the combination, the Deltacron, Delta variant, and the Omicron together. Deltacron. Everything, we're turning everything into fucking lame Transformers characters.
Right.
is what's happening. But it becomes part of the actual pop culture. As well.
Yeah.
The late night hosts are talking about the Omicron variant. They're making jokes. I mean, that's where it starts to go. Mm-hmm. So
and that's fine. Like, you gotta laugh. I mean, and certainly, like, television was pretty weird in the early parts of COVID, right? I mean, you had these people like making jokes and nobody was laughing, and like people stuck in their houses and they're making millions of dollars on Netflix.
People doing stuff from home. Conan O'Brien just from like his backyard.
Stephen Colbert was I actually loved watching Stephen Colbert.
He was great
during the pandemic.
Some people were better than others.
Yeah, some were better at it, and everybody. It was a learning curve for everybody. Mm-hmm. Yeah, everybody seemed to get. If this is the way it's going to be for a while, we had to adjust. We were doing remote podcasts. We were awkward at first with the remotes, and then we finally got the hang of it a little bit. But I still, like you said, I much prefer this face to face.
Oh, sure.
Whenever possible.
The smell of smoke in the air.
See, I haven't. See, I tried.
That's protecting us from COVID.
We're doing a Prognosis Ohio is a podcast about health in Ohio. I'm going to try really hard.
I wore my
not
nice
to
sweatshirt
smoke,
today.
Not to smoke.
Dina won't
during
smoke.
this episode of the podcast.
I appreciate it.
Dino, I know you smoke.
I know.
And I know you haven't gotten a colonoscopy. I know these things.
We respond.
Wait a second, you haven't gotten a colonoscopy?
No,
yet?
I have had a colonoscopy.
Okay.
I just haven't had one recently.
Okay.
I had my first colonoscopy when I was 50, and then they said I was on the 5-year plan. Then they told me that they tweaked it. You don't have to come back in 10. I was supposed to get one, so I am now.
And then COVID hit.
Yeah.
2 years overdue for my.
And he's doing his part as a patriot,
right,
to minimize.
Right.
But But is that an elective procedure? Because I know that they've been pushing off the elective procedures. I choose to have a colonoscopy or choose not to have a colonoscopy. Is that an elective procedure? Or
these things change. I mean, I just turned 45. What day is it? 3 days ago.
Congrats!
Hey, happy birthday!
So, thanks for wishing me a happy birthday. And I think it's 45 now for the first colonoscopy. It's not 50 anymore. But like these standards are always changing.
Mine was 40. I went 40.
Well, you have it in your
two parents that had cancer down there.
Yeah, you got it in your family. I didn't have any of it in my family, so
I feel left out.
Screening is very political, right? And there's all sorts of conversations about when X, Y, or Z should happen, because when you screen an entire population, you get false negatives, right? And so there's a cost to over screening as well. Right. But we're trying to find the balance here, which is people who never show up, and we're trying to get people to go and health centers in Ohio did amazing work during the pandemic when everything else was shut down. Like, man, we're just trying to do our best. And that's the thing I want for people is like, just shut the fuck up. People are trying. These people are working really, really hard, right? And you don't notice it.
The reason I haven't dealt with my colonoscopy is because I've been way too busy with my prostate.
There you go.
Okay, there you go. Is that a good enough answer?
Yeah. Well.
So there you go. There's my answer for you. One thing at a time. Someone said, because my doctor said when I was dealing, because I had some prostate issues and I dealt with them, and she says to me, I want you to get your colonoscopy, and I said, can I just? I've had a lot of oscopies in the last year. Can I just take a break?
Yeah.
And just not yet. And she goes, okay, fine, but I want you to have one. I mean, my doctor's she's a really good doctor.
Yeah.
I want you to have she wants the endoscopy, the colonoscopy, which I think is the same thing, lung scans, et cetera, et cetera. I get it. But in the midst of playing dodgeball against variant, like we're on Omicron now.
Yeah, A, B, C, D.
Thank you, Greek
Element,
alphabet. Whatever's next,
yeah.
I don't know.
I wish I was in a frat. Now I would know
We
all
are
this.
in the Omicron frat.
Oh, P. What's next? P.
Yeah.
What's P?
I don't know. I don't follow it.
I don't follow. I was never in a frat.
Well, and just so
yeah, I'm just saying I need a break.
and what you're talking about is reasonable, but that just affects you. If
Yeah,
all of a
just
sudden
me,
you
yeah.
drop dead because of XYZ,
Yeah.
obviously we'll all be bummed out, but it's not going to be contagious. I'm not going to get colon cancer from
I
sitting
can't
next
give you,
to you.
I can't give you colon cancer. I can't give you prostate cancer. But I can.
But you would like to.
That's true, though.
But I can. I can't give you the Omicron. I can't give you COVID.
And I think that's the big difference.
Yeah,
it's
that
like
is a huge
you're
difference.
allowed to call out your doctors or second guess or ask questions.
You know, but
But-
and the best doctors. Dino sounds like you have a fantastic doctor.
I really do. She's
Right.
a great doctor.
And the best doctors understand fatigue. They understand,
Yeah.
like, because oftentimes, people will not go to the doctor from especially men, right?
Yeah.
From 30 to 50, and then they show up at 50 or 55 with a whole bunch of stuff. And it's like, okay, well, let's start here. That's you don't start everywhere. You don't start and say, okay, clear your calendar for the next 3 weeks. We're going to give you every scopy, right? You say,
Felt that way for a minute.
Yeah, right.
It really did.
Yeah.
It's really
every scopy.
I came to the determination that ectomies are okay and endoscopies are not.
Okay.
If all of a sudden your appendix is about to burst, you need an appendectomy. Okay, the appendix. What am I doing? You've had your tonsils for way too long. You need a tonsillectomy. Okay,
Ectomy is
colonoscopy.
taken out, right?
basic language suggests that too many ectomies, not a good thing.
Not too many, but I'd rather have ectomies than oscopies.
Yeah. Right.
Right.
I'd rather have ectomies than oscopies.
Because
In my
ectomy,
ex-
there's an end to the.
In my experience.
you're
Fixing
done.
something, yeah.
You're done.
Yeah, ectomy, tonsils out, appendix
Done.
out.
Done.
Colonoscopy, you got to come back again.
Yeah, but you can't get an ectomy on your heart. You
No.
can't get an ectomy.
No.
You only have one liver.
All right, I get
Right, you
all
got two
that.
kidneys,
You got
which
two
is-
kidneys.
Try telling that to my first
Yeah.
wife. Oh. I don't know.
You don't have a first
I'm kidding.
wife.
I'm kidding about ripping my heart out. I just want to talk real quick, Dan. This is going to be a post-podcast conversation.
Yeah.
Since we talked, I had a vasectomy. And I just wanted to show you the stitches and.
But he's not a doctor.
I just
That's
wanted to
another
make.
ectomy, though.
I
He's
just wanted
not
to
a
make sure-
doctor.
Not that good.
But I just wanted to.
He's not a doctor unless you just want to show him,
just
just
wanted
to
to
show
show
him,
him,
which is
you know,
weird. If you
yeah.
just want to show him,
just wanna make sure
it
that
would be
everything
weird,
looks
and
okay
I'd also
down there,
be
Dan.
offended.
No.
I'd also
Dan.
be offended. You're going to show him, and you didn't show us.
Dan is a health expert.
He's not. He's a health policy expert.
It's closer than any of us
He
are.
can't look at you. He can't look at your vasectomy and go I think you did a nice job.
How do you know?
I think I do.
I know nothing about vasectomies.
But
The
do you
man
want to
had
see my
a
balls?
testicle removed.
Yeah.
That doesn't mean that he can sign off on your vasectomy.
Yeah, and also,
Give
I
me
mean,
this one thing.
I have to say, so there was one time,
I can't believe we spent 2.5 minutes on that conversation.
It's a rabbit hole we'll never get out of.
I'm a PhD, but not a physician.
There you
So
go.
there have been times where
I'd say post podcast.
You did.
I've given talks where people. I remember one time I gave a talk in New York and somebody came up to me and started unbuttoning their shirt. And they were like, "Would you be willing to look at it?" I was like, "No, put that shit on the no. I'm not that kind of a doctor."
Sign right under the mole. Just sign right under the
Exactly.
mole.
He's not that kind of a doctor.
But also, I will say, I mean, I have tremendous respect. I teach medical students, and I have no idea why they're doing it. I tell them all the time, I would never be a physician. I would never go through medical school.
oh man.
And I have no tolerance. When I went on my first tour of the campus for the job interview. Oh, here's the anatomy lab with the cadavers. Shut that.
Yeah, I don't
shut
need
it.
to see it.
Shut it. And people ask me questions like, I was talking to somebody recently. He's like, "Oh, did you? I wanted to look at the scoping for my colonoscopy. Like, literally, people enjoy this. I would never look at the scoping of a colonoscopy. I didn't want to keep my testicle when it was removed. Like,
Did they give you that option?
no, they didn't. But there are
You're not
people
Jewish, I
who,
guess,
who,
right?
who think this kind of stuff would be fun, and I have no interest in it.
I was actually.
I'm glad I didn't have the option to.
Yeah,
Well, I'm glad I don't have a missing testicle, but I would really think about it for a second.
But to the joke before, I mean, so vasectomies are only 90 something percent effective too. So you're still gambling.
Yeah, you're still at risk.
But you got like those odds, though,
Right?
We said that on the air. We said we all have a side bet that it didn't take.
Well, but to your don't look up joke, right? I mean, like that's the joke, right? There's
Yeah. Let's call it
It's
70
also
and
interesting to
keep
me
trying.
that you're out for
Yeah.
the ectomies, the tonsillectomy, and the appendectomy,
Yeah.
but you're awake
For the other one.
for the colonoscopy.
Oscopies.
Yeah, well, they say they twilight you, but I was awake for my colon. I was awake. I was awake.
I was talking baseball.
Yeah, and I was watching. I was watching it, and then they had I had a cystoscopy, which I don't wish on anybody.
What the hell's that?
A cystoscopy, I'm sorry, podcast listeners, cringe a little bit, is when they take a scope and put it through the head of your penis and check out everything that's going in with the urethra. This is in respects to the prostate issues.
And you're awake for that?
You're awake for that. You're awake for that. Oh, they numb the area with lidocaine.
Yeah, but it's all mental at that point, right?
Yeah, at that point, yeah. And I remember when the nurse came in. To apply the lidocaine. She was gorgeous.
She looked like Jessica Rabbit.
Right? She
Yeah,
was
yeah.
amazingly gorgeous, and and anytime somebody like that, as a basic man, you think this beautiful woman is about to rub something on my genitals. That's a good day.
Yeah.
But no,
Right.
My guy was well aware of what was happening. He went in like a turtle in a shell. It just backed up inside of me completely. Like run away. It was horrible. So my point being, and I was awake for it. I was awake for the cystoscopy.
Yeah.
And I remember the doctor that was doing it. He had an Indian physician who was an intern, and he was observing. And at one point, I'm actually chewing on the towel because like the old West, I'm actually biting on a towel.
Give me a bullet to bite on.
But the Indian physician is looking up at the screen. Mr. Traponis, you have a remarkable urethra, and I'm like, thank you. What am I supposed to say at that point? Thank you.
Nice to know.
Yeah, that's nice to know.
I want to just say something about this conversation,
All right.
which is, it is a good thing. So last time I think you had me on this show was from like Men's Health Month or whatever.
It was in
November 2019.
Do not let go by the fact that we are talking about this stuff.
Yes.
Right? Like, we're talking about
That's good.
colonoscopy. This is a good thing. We should be talking about testicular checks, and we should be
Yeah,
talking
for sure.
about colonoscopies. Like, this stuff was not talked about 20 years ago.
You're right.
You
You're
wouldn't
right.
have, you wouldn't have had a podcast because, what the fuck is that? But, like, definitely these kinds of subjects were not talked about, and that is something that is one of the few things that I actually think is good about our world right now.
That's a good thing. And
'cause
the
we
fact
used
that
to
we're sitting
separate
around
sound.
kind of busting balls, pun intended,
Literally.
about it all.
Or ball.
Or in your case, ball. Yeah, because if I remember correctly, that was kind of like an accident, right? That you found out you had an issue.
Well, it's always an accident.
I
I
mean,
mean, no, I was on a plane and I was uncomfortable because
Yeah.
there was something growing in my testicle.
You felt, yeah.
I mean, this is why it's extraordinary when you read Lance Armstrong's book about testicular cancer. I mean, he was describing a grapefruit-sized object growing in him that he ignored. I mean, is there no better illustration of how incredibly unhealthy masculinity is?
It's like he's walking around with a fucking bocce ball in his fucking crotch.
He didn't say anything for months and months and months, and he
Because
had
it
a
was-
very large object growing in his body, and he's very lucky to be
In his
alive.
testicles?
Yes.
So he had a third testicle, basically.
No, he had one testicle that was growing at a alarming rate, and knew it and was in lots of pain, but did not say anything. And that's precisely why talking about this kind of thing, like a podcast like this, actually just been like, hey, let's talk about colons. Let's talk about rectal cancer. That's cool.
Yeah, and I have no problem talking about my prostate issues, or I don't have a colon issue that I'm aware of anyway. But I'm gonna get my colonoscopy. Yeah. I will get all the oscopies and all the ectomies
You got to.
that I have to get, because
So you said
and
they
I
were
will get
cool.
and I will get another shot if they tell me to get another shot in respects to the next variant. I'll do that. I get a flu shot every year. It's fine. Give me all you got.
Right.
Give me everything that's available.
Right.
I'm 63 years old this 2022. I would like to live a lot longer.
I had
Which
this
brings me
conversation
to our final.
I just had this conversation.
We're going
with
to
my
close
dad,
out with my other question for you.
They just celebrated David Bowie's 75th birthday, and
Right.
he's been dead for 5 or 6 years. And my dad's turning 70. I was like, Jesus, Dad. And you think of these rock stars or these celebrities who drop off, but
Dude,
then you
dropping like
realize, like,
flies
well, fuck,
lately.
he died at 70. You know what I mean? Like, until I'm relatively young, and my parents are still young. Until you have
Right.
people that reach that age, it just really
When-
puts things in
when you get to
perspective
the-
of
when you
how
get to the
how
age
fragile
where you
life
know-
is. Right. I mean,
you got less left
than what you had.
Than
yeah,
what you had.
yeah. Or my parents and my friends
Yeah.
and things, and you hope you can live forever.
No, I'm not going to live forever. I don't want to live forever, but I like to live longer. I don't want to wrap it up at, God rest his soul, Bob Saget. I don't want to be done
no,
at
that's so
65.
sad.
I would like to continue. So if there's something that I can do, I do go to the doctor on a regular basis. If there's something up, let's take care of it. I don't. Yes, I know. I drink, not to excess. I smoke too much. I should quit. I know that. If they told me tomorrow, God forbid, you had lung cancer, I would say, you know what? Okay, that's fair. I've been smoking since I was, 20 years old.
Yeah.
Not excessively, but still, I get it. I rolled the dice on that one. That's on me. I wouldn't go, oh my God. I'd be sad, but I would say I didn't do anything about that.
But let me just say, before your final question,
Yeah.
do not underestimate the kind of like, I don't know if anybody's ever talked about what you do as leadership, but there is a leadership component to talking about these things. Your willingness to talk about that, your willingness to, not that your listeners are gonna, go do whatever you say. I hope
No.
not. Otherwise, you'd be running a
I tell
cult.
people all the time, don't smoke. It's horrible.
Right, but that matters, right? That really matters.
I don't think smoking is cool. I don't think smoking. I'm an addicted cigarette smoker.
But
it's horrible.
But you're an aficionado of film and of American culture. I'm surrounded here by like some of the seminal images
Right.
of our culture. I mean, there was a glibness about these things, and those people, some of them lived pretty long, but like some of them died way too early.
Right.
So like maybe we can do a little bit better. I always thought about Fidel Castro, right? The guy that we always think about as having a cigar, but he stopped smoking a cigar pretty early because he realized that he could live a longer life. If he did stop. And it was also hugely important to an entire country that said, he stopped smoking. Maybe we should do that too.
Yeah.
So it's like, I think we need to take that seriously.
You make a valid point. My father died from lung cancer. Granted, he smoked, I think 4 to 5 packs a day.
Was he unfiltered?
Huh?
Unfiltered cigarettes?
I think he was smoking filters by the time, but at one point they were unfiltered. But you have to be smoking constantly.
Yeah.
That's if you smoke 5 packs, that's 100 cigarettes a
chain
day.
smoking, yeah.
You have to be smoking. And when he got diagnosed with lung cancer, he didn't quit. He cut back to 2.
Right.
Or
2 packs.
2 packs
Okay.
a day. He cut back, not 2 cigarettes,
Right.
2
ridiculous.
packs.
Well, he tried.
Yeah, he tried. And he lived to be 83, I think, 83 years of age.
I've been
So,
watching that
but-
Beatles documentary.
Well, you know what? What other example do I need?
Right,
Your
right.
dad died of lung cancer. But there's that. Yeah, but he lived to be 83, and 83 was pretty good, and he had pretty good health right up to his last year. Those are the
blue
stupid
zone.
rationalizations that you
Add 10 years in
Well,
today's.
and there you go. That's
He
it goes
could've
back
been
to the bottom
93.
line is that we all rationalize what to fit our own narrative. Whether we support masks or not, whatever it is, you find that one thing to rationalize.
So
Wait, real quick. I've taken a slightly different perspective, and I don't think it's necessarily a healthy perspective. But it's very important to me to not be a cliche in my life. And when most patients go to physicians, it's like kind of obvious what needs to happen. You got to stop smoking. You got to lose some weight. You got to stop, this or
right,
that.
I get all
Like,
that.
Yeah, no, of course, and you should, but also like that's not going to be the difference maker necessarily with that. So for me, I worry a little bit about like, well, am I doing the obvious stuff? Like, if I want to go out early, it's got to be big, like something totally. I mean, in a way, it's really sad. Like, we're in the middle of a pandemic, but people are dying from fairly routine things that could have been prevented that are not pandemic related.
Right.
And like,
Very true.
And that's a part of the story of the pandemic. When you read the history of it, like, you can read great histories of the influenza pandemic of 17, 18.
Right.
Those, you don't hear about the people who didn't go see doctors because of the other problems. And that's the stuff that destroys families and communities. And like, that's the stuff that really matters, actually.
Yeah, I totally agree with that. Yeah, it doesn't help when you go to the doctor too, and she's, got the stethoscope on you, and she's checking your breathing and so forth and so on, and she's like, "Did you quit smoking?" I'm like, "No." She goes, "Oh, really?" She goes, "Your lungs are like super clear, and your oxygen levels are like."
I paid her to say that.
Your oxygen levels are.
And you're like, I sleep in a chamber, like
99.
Michael Jackson did.
So-
Boba Fett. Anybody watching the new?
Yes, I am. Yeah,
So
we'll see.
my question, I teased it right at the beginning of the podcast. I said, we come across a lot of stories, and I'm not asking you because you're not a physician, you're a health policy. Say it again for me,
Professor,
not a health policy professor. But you hear about people that live to be. We always have stories on the radio about people who live to be 100.
Yeah.
And you always hear, what's it take to live to be 100? Do I have to soak 9 raisins a day in gin and have those every day? Yeah. Do I have to have one of these like the old man in Scotland who's 105 has in the morning, one of these every day? Do I have to go to McDonald's and have a Big Mac every day like the 106-year-old lady in Philadelphia? You hear all these stories of longevity, and when you hear about what they do or what they didn't do, it's always kind of interesting and remarkable going, they had a drink every day of their life. They ate what they wanted to eat their entire life. Betty White, God rest her soul, loved hot dogs.
In vodka.
99, for God's sake.
So what are your thoughts on
Yeah.
how do we live to be 100?
Let me tell you a story. I this might be a little longer than you wanted, but
No, we
you
get
asked the question.
I did ask the question.
So it's your punishment. In another part of my life, I work with somebody who is the only living Nuremberg prosecutor alive.
Oh, wow.
I met him, 30 years ago now. There's a fluke. We'll talk about that story another time.
Yeah.
But, he is now 101 years old.
That's amazing.
And at 27, had the biggest case of his life.
Right.
Prosecute in the second round of Nuremberg prosecutions with these Nazi gunmen called the Einsatzgruppen. And he's like a grandfather to me. I didn't really have grandfathers growing up, so he always served that role. And I've observed him over the years, and he's going to be 102 in March. Maybe 103. We don't know because of Hungarian birth records.
It's like Albert Pujols.
Yeah, but there's two things I want to say about. I think I get that joke.
He's old.
He's old.
Okay, but not 101.
No.
Nobody knows how old he is.
But his name is Ben Ferenc, and he's a hero of mine, and I'm really lucky to have known him and to be working with him in my life. And I run his website and things like this. It's just a side project, a passion project. He swam pretty much every day of his life. Swimming.
Great exercise.
Swimming makes you move, and is great for your lungs.
Yeah.
Every time I saw Ben, every time I go to visit him, we would eat Chinese food. So that's not the problem. But so Chinese food, okay. He calls it clean living. I mean, certainly on Whiskey Business, a little heretical to say you've got to keep track of the drinking,
Sure.
got to keep track of the smoking,
Sure.
that kind of stuff.
Get out of here.
And certainly some of it, I will just give you this get out of jail free card, is genetic disposition, and like you're lucky, and it works out well.
I know that genetics have a lot to do.
But
with
here's the thing I want to share, and this is a weird. I didn't expect to talk about this, but I will just say, I run his Twitter feed, and I deal with all the nonsense. And he's 101, and people think he's on Twitter, but it's me. I say that. But, all these people writing in from all over the world, because he's famous. He's going to get a Congressional Medal of Freedom in a few weeks.
Oh, awesome. No, cool. That's awesome.
People writing in saying, will you take my case? They're making us get vaccinations in Switzerland.
Will you take my case?
He's 101, first of all. It's like, no, I'm not taking your fucking case. But but writing in from all over places, who think, and it will say things to a famous, very distinguished Nuremberg prosecutor who's 101 years old. This is the same thing as what the Nazis did.
Oh, I've heard this.
Oh, wow, yeah.
And it's all over the place. And I get these emails all the time. And first of all, it's not. It's not the same thing. Not even close. But what I do, and this is my final point on this, I send them a photo of him getting vaccinated, which we had taken
intentionally
for this purpose, right? To let people know that, no, this is not the same thing. And you got to read some goddamn history books and understand what happened in the Holocaust, because this ain't it.
No.
And get vaccinated. That's what he wants you to do. So when I think about that kind of stuff, I mean, the lack of historical memory. When you think about Jonas Salk and the invention of the polio vaccination and how important that was to people's lives, we are just throwing away a century of aggressive scientific inquiry and exploration, and we should be celebrating it and thanking them instead of just like throwing it back in their face.
Yeah, you talk about Salk and the polio vaccine. Does anybody in this room know who stumbled across the vaccine that we're taking right now?
Oh,
or any of them that we've taken since when they first when they all hustled and went as fast as they could to fight this, to try to come up with something? Does anybody in this room
Anthony Fauci
know who the person is? No.
Trump.
I don't. Yeah, no. Shut up.
No. And that's the thing, too, is like
does anybody know?
No, there's millions of people trying to figure it out. Well, maybe not millions
I
of people,
understand
but a lot of
what
people.
I'm saying.
No, but they should be given Nobels.
Right.
Instead of being raked over the coals.
Exactly. Yeah. That's my point.
Yep.
And that's what people who care about humanity do. Right. And I think that's why I raise this story, because I mean he's a hero of mine. I'm sure you would have no problem with me sharing the story.
No, not at all.
Because
it's a great story.
These are people who have been through hell and back, who understand what it means to do something positive for humanity as opposed to doing something that's selfish and something that is frankly harmful to our society. And the same people who are complaining that they can't do X, Y, or Z are implicated in in dragging it out, in making it way worse, with way more deaths, and that's unforgivable.
It's going to be, it's going to be interesting, like you said, to look back.
Unforgivable. I like that
now.
too.
Yeah.
Yeah. Oh God. Yeah. Again, I go back to my kids. I remember talking to my mom. Lived in Florida during the Cuba missile crisis. And they would do these drills where they would hide.
Was alive during the Cuban
Yeah.
Missile Crisis.
But specifically,
I was
but
alive.
they were
I was
specifically
a kid,
in Florida at these military bases. My grandfather was in the Air Force, and they would hide under desks, which was not going to survive. Anyway,
Duck and cover.
yeah. Long story short is
Duck and cover was real. Come on.
I remember my mom
Duck
talking
and cover
about that,
was
and
real.
then I guess my generation, our generation to some degree, I guess maybe not all of us, but mine be 9/11. Where were you when 9/11 happened? But yeah, I think of these kids, my kids, and saying, okay, well, this is it, COVID, and I hope that it wraps up so that they can when they can go to their senior prom without having to fucking
Do you remember
wear
when
hazmat suits
after
and shit.
9/11? Do you remember all the restrictions that we had to do
Right,
when
right,
we came to
right,
the
right,
airport?
yeah.
Had to take off our shoes. You remember everybody just raising Cain and bitching like nobody's business about how they had to do this, and that in order just to fly to Florida.
We still do those things.
We
It's
still
now
do.
second
It's
nature,
been
though.
20 years.
Yeah, we
Right,
still.
but so that's the point, is so-
but now you don't think twice.
Right.
Now
So-
you don't
right,
think
so-
twice about having to
take your shoes
off or do
I guess my
whatever you have
point
to
is
do.
is
My
that
point
I
is-
hope it settles down enough so that we can look back
I'm
when
hoping
my
that we don't think
kids
twice.
when my kids are this
Yeah.
age, they can look back and be like, oh yeah, that was fucking crazy, but this came out of it, and what did we learn, and who did we see that were giant fucking assholes along the way?
Oh, nobody will know that.
I hope that's the case.
I don't know. I mean, that's the only thing I can hope for as a young dad. I think. I mean, you.
Yeah.
Dan's got kids.
You know, when COVID started, I called a meeting of a kind of group of students that had been leaning on me. You know, as a faculty member, like, you find your people, and you become a mentor to not everybody, but maybe a select group of students. And I said to them, do not miss this moment. Like, we are heading into something real here, and you are in medical school. Like, make sure, like, this is going to be super annoying. You're gonna complain about a lot of things that are going to happen. How we're going to deliver classes is in question. But in 30 years or 20 years, you're going to look back and you're going to be somebody who went to medical school during one of the most world historic pandemics we have ever experienced.
Right.
Do not miss this. Take notes, learn something, come out of this better.
Good.
And I'm worried about this. I'm worried that they have.
That they have.
I don't know that they have. I don't know that we have.
Or they haven't
come out of it.
That
they've learned something. That we've.
we're hoping that they have.
I want to make sure we've harnessed this moment.
But you know how it is when you're in the moment.
Right.
When you're in the moment, you are literally in the moment, and you're not thinking about, okay, I need to remember this because 10 years from now,
But dude, that's why you have
great grandkids are going to be asking.
That's why there's people like you.
That's why you have professors.
That's
and
why there's people like you.
That's
to tell
why.
them.
That's why I was saying, that's what parents should be doing.
Right.
That's what people in positions of maturity and authority. That's why our legislatures are such embarrassments, because they're missing the moment. They're missing the moment to make this better for us.
They're missing the moment to make it better for us and focusing on things that are making it worse for us.
Yeah, and we're not going to, and maybe because of Omicron, and this is maybe the only silver lining of Omicron, it gave us just a little bit longer to figure out how to come out of this a little smarter and a little better than we were.
Maybe.
Because we didn't do it with Delta.
Yeah.
So maybe there's somebody who's going to stand up and say, you know what, this has been long enough. We need to make sure that this moment doesn't get lost.
Right. I hope that's the case. That's a good place to wrap things up tonight. That we hope that this podcast doesn't get lost on you this evening. I want to thank Dan Skinner from Prognosis Ohio. Woo-hoo. Info on Prognosis Ohio. People want to check out your podcast. How do they do that?
Yeah, so PrognosisOhio.com. We got our 100th episode coming up.
Right.
I interviewed Sherrod Brown, our U.S. state U.S. senator, which was very cool.
A good get.
And we've got a great bunch of episodes coming up. So PrognosisOhio.com, and we'd always love to do the kind of work that connects us with people like Whiskey Business, right? I mean, like, it's all about just having conversations.
And we will have you back. I promise we will have you back to talk about the actual book about the opioid. I'm sorry that other things in life have supplanted that particular spot on the podcast.
I'm sorry to tell you, Dino, that there's going to be another book by then.
Okay, great. then we'll have that book, and we'll talk about the other book.
Can people find it? Where can they buy it?
Where can they get the book?
No,
we're gonna get the book. Seriously.
No.
Yeah, I mean,
It's about the opioid crisis.
yeah, yeah. The story,
Which is ongoing and still exists as we speak. It's just not the star problem.
Well,
right
that's
now.
kind of what
not
you're saying.
far from me. Stories of opioids in Ohio,
Yeah.
which is available wherever fine books are available.
Wherever fine
fine books. He
Yeah.
So
wrote a
Amazon.
fine book.
Basically
He
Amazon.
wrote a-
Which is
That's the
different than
only-
shitty podcasts.
Yeah, exactly. You don't have a shitty podcast. You have a great podcast.
You do
And
have a
Sherrod
great
Brown. We
podcast.
can't get Sherrod Brown
no
on the
shit, man.
podcast.
I mean, you might.
Does he like whiskey?
I don't know.
No, ask him for it.
This is all about the whiskey business marketing research team,
We don't have one.
and you've got to figure out who likes
We don't have
whiskey.
one.
That's
Hey,
on you.
No.
guys over there.
no.
I'm just asking
I
the
mean,
interns.
we have Dan Skinner this
you
week.
three, go check. 4 of you go over there. 5 of you get a hold of. Okay.
Yeah, we don't have anybody like that.
Yeah.
We don't know who we're getting
Our
from
team-
week
No,
to
the
week.
sheer amount of interns running around this house
Yeah, right.
is actually
Right.
quite astounding.
We get a
Keep it
very,
down.
very informative, passionate podcast like this.
Dan Skinner is talking. Skinner.
Next week, I think we have Karina Nova from 10 TV.
Oh.
So, coming on. Talking about her career. So
We're gonna drink vodka?
Yeah, she drinks vodka. She's going to have to drink whiskey,
No,
though.
don't go there.
Yeah.
Is that contentious on the show? Like, do you do the rum versus vodka versus?
And you know what? You don't have to drink whiskey on this show. You can drink whatever you want on the show. We, the three of us, collectively, will drink the
we
whiskey.
drank bourbon barrel gin.
We did
That's right.
gin. We
Yep.
did gin one time for Fritz.
Because somebody
Fritz
told me
Barrel.
recently that they make hot toddies with rum, and I was
You can make hot toddies.
I was appalled.
No, you
You
can't.
do. You can.
No, you can't.
Yes, you can.
No, you can't.
Yes, you
You
can.
can do anything.
Can't. Can't.
So all of a sudden,
You
it's
can't.
turned into a bad musical. I can do anything.
No, you can't. Hot toddy.
You can make a hot toddy with rum.
No, you can't.
Yes, you
No, you
can. You can put rum in
can't.
it.
No,
Anyway,
you can't.
Moving on.
Dan Skinner, Prognosis Ohio. The guest bottle is now empty, and I know because Hansberry is trying to write a musical while we're doing the podcast.
Yes.
The Wild Turkey
Very
Rare
good, by
Breed
the way. Very
Barrel Proof
good.
Rye. Thank you.
No, thank
for bringing
you.
that. I'm sorry we killed it.
Well, I had tasted it before we came. We don't always
Yeah.
do that.
Tasted
but,
it was like a third empty.
It was like the neck. There's not as much fluid in the neck.
I always tell my wife that, actually.
Yeah.
You know how much blame I get for him?
I'm sure.
That
I'm glad that I was able to bring this.
my
Shout
fault.
out to cousin Ben Rupert, who made sure that I bought this because he says this is his favorite whiskey or rye. I guess,
and we're not having any more whiskey after the podcast is done because we both have a morning show to do tomorrow.
That's right.
Hello.
You
Yeah,
talking to me?
talking to you, producer
What?
of the morning show tomorrow
time?
morning. Yeah.
Who?
Yep.
You know, we're on the Evergreen Podcast Network.
We are on the Evergreen Podcast Network tonight, and tomorrow we're on Sunny 95. So
Subscribe on your favorite podcast.
There you go.
app.
See how I did that?
very nice, very subtle, Johnny. Very nice. Okay.
We kid. No, yeah. Thank you for subscribing. And if you subscribe on a podcasting app that you can rate and review us, please do that.
Please
Thank
do
you
that.
much.
Very nice.
Facebook, Instagram, Twitter, and YouTube, Whiskey Business with Dina Tripodis. By the
Peacock,
way, yeah.
You're not throwing in a fictitious one this time?
Well, hold on, I'm not done quite yet. Because
Fictitious social media. Like,
no.
fictitious fictitious site where the podcast
Well, I
doesn't
just wanted to
exist.
say that.
Not
for the-
fictitious, an actual site, but we don't belong on them.
I guess I'll keep this for the audio folks, but like I'm editing a shit ton out of this episode. So
Why?
Well, because not a
What
shit
part?
ton, but a medium amount. The point is that John keeps the fully unedited
Right, on
video
YouTube.
on
YouTube,
YouTube Whiskey Business.
The
with
video
Dina
is
Tripodis.
as it is.
and I clean up the audio.
Yeah.
No, we're actually on Paramount.
I was gonna say Paramount.
Well, only because Kevin Costner, he reached out to us today and asked us to be a part of Yellowstone.
He did
Oh,
not.
did he really?
Yeah.
I can ride a horse.
What are you talking about?
You didn't get that memo?
What memo?
He needs more support on the Paramount network. He says, I know some guys.
And they like whiskey. I like whiskey.
Yeah. All you think about, Yellowstone, you think about saddling up and drinking some whiskey in
There's
a
a
saloon.
whiskey called Yellowstone, I believe.
Exactly. He says, I know.
It got some SAG nominations today.
I'm lost.
You can see that's a rabbit hole. He's
Totally lost. You know what? And here's the key, the kicker. I don't want to be found.
I want to be found.
Don't find me.
Anyway,
I go down these rabbit holes with the boy.
Thank you for listening to all of our nonsense.
And thank you, Kevin Costner.
You just won us another award.
Oh my gosh. Wherever you're at, people, my name is Dino Tripodis. I am the host of Whiskey Business. That's our audio producer, Greg Hansberry. That's our video producer, John Whitney. Our guest has been Dan Skinner from Prognosis, Ohio. Happy New Year. I don't know what the over-under is on wishing people Happy New Year, but I think we can still get away with it. Until the next bottle. See ya.